on our return to school planning. We just had a meeting with our staff as well at about 4 p.m. So we're going to get into just basically the purpose of this presentation for parents is to share the priorities for the new school year, to update you on the new health guidance and local metrics that we're working with, and then share our reopening plan recommendations based on those priorities and returning to school plans and guidance and local metrics. I do want to, as I have in the past, put out the caveat that this information is based on the latest guidance that we received. It's subject to change. In fact, just about an hour ago, we received another significant change in guidance, which we were working in between the teacher session and this session to try to recraft some of our slides to coincide with that. But basically, we want to provide you just an update on where things are at for the start of the year as we know right now based on the new guidance that we received, the most recent. So if you have any questions that are not related to this presentation regarding our school reopening plans, there is a form link at the bottom of this slide that you can click on and you can add in your questions and we will get back to you either via email or directly. As well, Dave, they should be able to ask questions in the chat box related to this presentation as well, right?
Yes, either the chat box or the Q&A also, they can enter questions there.
Perfect. So as I said, we wanted to share first what our priorities are for the school year. As always, we are prioritizing the safety and well-being of students and staff as we make our plans. We are committed to full in-person learning as well as resuming all of our extracurriculars and after-school activities that we weren't able to provide last year. We will be resuming all of those. We're committed to, we really want to minimize disruptions such as the quarantining that we had to deal with last year for students so that we don't disrupt student learning and teaching. We also want to minimize the burden on families that you experienced with daycare, et cetera, while children had to quarantine. So we're really focusing our efforts on minimizing that. And then of course, addressing the learning and social emotional needs of students. So let's get into the new guidance. This has been coming out since July 9th. We have been reading over all of that guidance. Our advising agencies and guiding agencies are of course the Centers for Disease Control, the Illinois Department of Public Health, DuPage County Health Department, the American Academy of Pediatrics, our local healthcare providers. We've been consulting with Pediatric Health Associates, Dr. Shashara, who is the president of that association, as well as referring to our collective liability insurance cooperative and our legal counsel. So there have been some major changes. Literally about an hour ago, there was a change from the CDC guidance, and the major changes from all of those entities are really promotion of vaccination as the leading public health prevention strategy. All of the agencies are saying that the major promotion or prevention of COVID-19 is promoting vaccines and getting as many eligible people vaccinated as possible. Second to that is aligning masking recommendations with the CDC guidance. So the CDC did just come out about an hour ago with additional guidance on masking for schools, specifically for schools. But I think most importantly this year, what we're hearing is an additional emphasis on the importance of students being in person, regardless of whether or not all the prevention strategies can be implemented. So for example, if we cannot maintain 3-foot distancing in schools, that is not a reason to not have school in session and fully have students resumed in session. That's where they recommend additional mitigations or additional safety measures put in place to ensure that the priority is on in-person learning. So where are things at with regard to masks? So as of today, an hour ago, the CDC just put out a recommendation that everyone, including fully vaccinated individuals, wear a mask in public indoor settings in areas with substantial and high community transmission. They also put out a recommendation, and Illinois Department of Public Health followed suit in supporting that, was that recommending universal indoor masking for all teachers, students, and visitors to K through 12 schools and preschools, regardless of vaccination status. And that was a shift. Earlier, they were recommending masking for those that were unvaccinated. Now they're recommending just universally everybody wearing a mask, regardless of vaccination status in schools, mainly if you read the guidance, due to the new Delta variant that appears to be becoming more prevalent, as well as just schools not being able to really monitor vaccinations, as well as, just that being sort of a public discussion and not being able to monitor all that. So that's where that's at, and that is as of this afternoon. So you're getting that information as we received it as well. So the American Academy of Pediatrics on July 19th put out a statement with regard to universal masking, basically stating as we start the 2021-22 school year, they understand that large portions of students are not eligible to be vaccinated. There are COVID variants that are more contagious because of this. They believe that all students in schools should be wearing masks, and they urge pediatricians to work with schools and local health officials to promote childhood vaccination messaging before the start of the year. So what are those local metrics? We have been advised to continue to monitor that. We will monitor that in August. We've been monitoring it over the summer. According to the CDC, we should be monitoring community transmissions, our vaccination coverage, screening, testing, and any occurrence of outbreaks to guide decisions on levels of layered preventions. So for example, if we see a high level of community transmission occurring, if we have low vaccination, then they highly recommend that we continue with layered prevention. So they would not recommend, removing masks, et cetera, et cetera. So what is our current, this is as of this week, and this has changed since 2 weeks ago. 2 weeks ago, we were, according to IDPH, Illinois Department of Public Health, we were at a minimal transmission. This week, we've moved to substantial for the following reasons. If you see the indicators in the boxes here, it's based on test positivity, county case rates per 100,000 people, overall case numbers or new cases, and county youth case numbers. So we're in the minimal for test positivity. It's less than 5%. I believe it's at 2.4. County case rates per 100,000, we're still less than 50. And youth case counts are still in that range. However, over the past couple of weeks, there has been an increase greater than 20% in the overall new numbers. And so those breakdowns are right here. Test positivity is still in the minimal at 2.4%. New cases per 100,000 are at 28 cases per 100,000. The new cases reported are now at 263, which is a substantial increase. And youth cases are now at 67, but still in the minimal. So our vaccinations, we have been monitoring those. We've held several clinics. We will continue to do so for the convenience of parents. As of July 15th, we had about 10% of our middle school students vaccinated at our clinic. We don't know how many others may have done that through their own pediatrician. And we have about 80% of our staff vaccinated. And then you can see the numbers for DuPage County and Illinois are to the right as well. As well, we did run a larger than normal summer school. We invited all students to attend. We had over 1,500 students in our summer camp and extended school year programming. All staff and students were required to wear masks. No positive student cases were reported. There was one positive student case, but it was identified as a result of travel. We did have a student quarantine due to family member testing positive. We had some symptomatic students, but they tested negative and returned quickly to school. And we did have one staff member test positive, but was quarantined per the current guidelines. So I'm going to turn it over to Leah DeLuca to give you an update on what our return to school plans are with regard to instruction. And then we'll follow up with Kim providing more information on the layered mitigations and safety protocols for the start of the year.
Good evening, everyone, and welcome. Thank you for coming. Christina, you can go ahead and go to the next slide. So as we continued through our school year last year, we did continue to provide remote instruction for those families that selected remote. We did have many students return back to in-person learning. However, we did have a handful of families that did choose remote. Based on the new guidance there will no longer be remote instruction. The remote instruction will only be available for students who are not eligible for the COVID vaccine and are under a quarantine order by the local public health department and IDPH. So what this means is that if a student is a close contact of an individual that was positive, or if the student is positive him or herself, then they would be under quarantine and they would be eligible for remote instruction. So as a district, we will continue to provide remote instruction through both asynchronous and synchronous learning opportunities from a remote classroom teacher. This is not a teacher that would be your child's teacher throughout the school year. This is an individual that has been hired, a new board approved position that we have added to each school building. And at the middle school, we've added 3 of these remote teachers. So that is the individual that will be providing the remote support to those students who are in quarantine. Also, our in-person learning model has changed from last year. Previously, we were attending 4 days a week in person and Mondays were remote. We are now moving to a 5 full days a week in person, and we will be reverting back to our normal schedules in every school building, where all students will have music, PE, art, and SEL at the elementary level. And at the middle school, they will continue to run their full schedule. The remote teacher, the remote learning teacher that I mentioned in the first slide, will work with students that are specifically in quarantine. They'll act as a liaison between parents, teachers, and the classroom teachers. So they will be responsible for collecting assignments for students, work for students, any of the content that they're missing, and they will be providing that to students during that quarantine period. They will also provide a synchronous time, a Zoom call, where students will be able to interact with the teacher and ask any questions that they might have and obtain extra support from that remote teacher in literacy and math. So although the entire day will not be synchronous, there will be specific times during the day that the remote teacher will be available to support students that are in quarantine.
Do you want to further explain what synchronous and asynchronous means, or just a reminder, Leah?
Yes, no problem. So synchronous is when the student and the teacher are live together on Zoom. So teachers will, again, have those remote teachers will have Zoom links where students will be able to access that remote teacher via Zoom, as we have done in the previous year and a half. The asynchronous is really that work that the student does independently. So that work will be provided to the students through that remote teacher, and that work will be provided to parents as well at the elementary level to make sure that the students receive it, but they will be both asynchronous and synchronous. So there will be time on Zoom with a teacher live, but there will also be independent work time. Homebound instruction. So in the past, we did have that remote option, which we will no longer offer. For students who have medical conditions that are certified by a physician, and that will result in a minimum of 10 days of absences during the school year, they will be eligible for homebound instruction. We have put out surveys to families, and we do have a few students that qualify for homebound instruction. However, this has to be certified by a physician, and the Department of Student Services will work with the families to make sure that they're receiving the appropriate information regarding homebound instruction. ISB recommends 1 hour to 5 hours per week of that homebound instruction, unless the student's medical statement indicates that the child should receive less. So again, this is a very small number of students that qualify for this. And this is directly due to medical conditions that do not allow the child to be in school as often as other students. Each year, we tend to have severe weather situations. And now that we have a strong remote learning program in place that's been approved by the Illinois State Board of Education, we will now use our severe weather days as remote days, where teachers and students will be virtual on Zoom for instruction for the entire day. This means that there will no longer be emergency days added to the end of the school year. So all severe weather days will be replaced with remote learning days, and we will not have to add days to the end of the school year. Thank you. Kim?
Good evening, everyone, and thank you so much for joining us. My name is Kim Wasinski. I'm the Director of Student Services here in District 33. I'm going to talk to you a little bit this evening about our continued efforts for mitigation strategies here in the district as we prioritize student health and safety for the upcoming school year. As a district, we completely understand and respect the various viewpoints of individuals related to wearing masks and receiving vaccinations. The intent of our message today is just to inform you of our goal, which is to keep students in the classroom, minimize the loss of in-person instruction due to quarantine, as well as reduce the burden on families that you experience when children do have to be out of school due to being in close contact or testing positive for COVID. Some of the strategies we will be using this year are weekly COVID screenings, requiring masks for unvaccinated individuals. We will continue to test for COVID when students and staff are symptomatic, and we will encourage staff and students to stay home when they are sick.
And Kim, I just want to clarify a number 2 that has changed in the last hour.
Yes, thank you so much, Christina, for bringing that to my attention. Yes, we are now, based on the most current guidance, requiring masks for everyone, vaccinated or unvaccinated, in the public school setting for the upcoming school year. That is correct.
And that is until we receive additional information with regard to thresholds, because there is information that has been shared as well that layered prevention strategies can be minimized or removed with when the thresholds change or the metrics or local metrics change. We just don't know what those are yet. So we're starting the year off, and once we know more, if that improves, then we anticipate getting additional guidance to be able to remove some of those mitigations, such as possibly masks, maybe the distancing, et cetera. But until then, we're going with the guidance that as presented.
Absolutely. It's such a fluid situation for sure. Because of that, we, for next year, will be putting in place several prevention strategies. Obviously, the gold standard is vaccinations, but we have students who are under the age of 12 who are not eligible. We are encouraging those who are 12 and over to get vaccinated for COVID, if and when possible, prior to the school year starting. Mask requirements, social distancing, screening, continuing with those hygiene and sanitization standards. And as a district, we will continue to monitor data for the upcoming school year to help us guide our decision making. Vaccination, according to the Centers for Disease Control, is currently the leading public health strategy that is going to help us end this pandemic. For the upcoming school year, parents will be asked to share a child's COVID vaccination status for those who are eligible, which will help us with contact tracing and hopefully help us to also avoid quarantine if and when possible. Parents of unvaccinated students will be asked prior to the start of the school year to participate in regular Shield screening, and I'll get to that in the next slide or so. That screening will also help us to avoid lengthy quarantines or limit the number of students and staff who have to be excluded from school due to being a close contact or developing symptoms. Vaccines will continue to be strongly encouraged for students who are 12 and up as well. As was mentioned, the CDC, as of today, is recommending indoor masking for all teachers, staff, students, and visitors in the schools, regardless of their vaccination status. We will monitor this guidance as recommended and update that as is appropriate. For the upcoming school year, we will continue to consider mask exemptions with proper medical documentation. There are some individuals with medical conditions or disabilities that do make it difficult for them to wear masks. And so we will work with those families individually to plan for what types of accommodations would be appropriate. And we will develop a plan for any adaptations or goals that might be necessary to help increase a student's desensitivity to masks whenever possible. CDC recommends that we continue to maintain social distancing. They have, however, reduced that circle of who we consider a close contact from 6 feet down to 3 feet. So that bubble is a little bit smaller. So we have worked very hard with our building and grounds team and our administrative team to ensure that there is 3 feet in between all desks within the classroom, as well as in the cafeteria. When 3 feet distances cannot be ensured, students will be allowed to eat lunch in their classrooms. The next layer of prevention is that continued screening, sanitation, hand hygiene, and etiquette. Screening for COVID-19 will definitely be key in helping us to identify cases. We will be asking for staff and students to voluntarily participate in a weekly screening program. It will be free for all students and staff. Hand washing stations, hand sanitizer, and PPE will continue to be available for students as well as staff. The cleaning and disinfection protocols will continue, and we will also continue to encourage students and staff to stay home when they are sick. So I've mentioned screening and testing, and just wanted to kind of go over the difference real briefly. In terms of screening for COVID-19, when we screen for COVID, we're really looking at an overall assessment of who may have symptoms and not be aware of that. So the screening is something that's done weekly, and it's done by opting into that. It's preventative. We are able to detect COVID 2 to 3 days before individuals show symptoms, which helps to reduce the amount of time that students or staff can actually shed or spread the virus. That early identification dramatically minimizes the number of people then who are required to quarantine and protects those who are vaccinated as well as unvaccinated in schools. Testing, on the other hand, is done when someone is symptomatic or has been a close contact to an individual with COVID, and is used to rule out whether or not someone has contracted the virus. We will be continuing to offer free on-site testing for students and staff, which is a convenience for staff as well as for families, because it eliminates that need for a follow-up medical appointment. On-site testing can also reduce the length of quarantine for those who are symptomatic. Once you receive those results and have that documentation of that negative RT-PCR COVID test, students and staff are able to safely return to school. Occupancy on buses this year will not be limited, but masks per the current guidelines must be worn. Food services will proceed with 3-foot social distancing to the greatest extent possible. Masks will be required by all visitors to our schools this year. Facility rentals will resume, but school guidelines will have to be followed to ensure all safety protocols are adhered to. And local field trips will be allowed to resume, provided safety guidelines can be met. And alternate experiences will also be provided whenever possible.
Thank you, Kim. So this concludes just our preliminary information session. Again, if you have any questions that are not related to this presentation, I want to direct you to this form because we don't want to miss out on any other questions, but we do want to answer some of your Q&A questions in just a minute. Just to make you aware, the next steps in our timeline is after this parent coffee with staff and parents, we will be presenting to the Board of Education on August 5th. All the new guidance and our return to school protocols, as well as providing then the next day parent communication on those return to school plans. We anticipate possible changes even up until that point, so you may receive different information that you've received today or even newer information. I do anticipate the DuPage County Health Department coming out with some statements, as well as the Illinois State Board of Education, given what was presented today by the CDC and the Illinois Department of Public Health. But as I said, it's very new. We are also offering vaccinations on August 17th and 19th. The 17th does happen to be the middle school orientation night, but it will be there in the Lehman parking lot. It's presented by or provided by the DuPage County Vaccination Caravan. So it's not the school doing it, it's the DuPage County Health Department. That will be the first dose provided from 4 to 6 p.m. On those 2 days, and the follow-up is on September 7th and 9th. In between all that is our first days of school, August 25th and 26th for kinder and September 2nd for preschool. Again, here's the information for the vaccination clinics. It's provided for all students, staff, families, and community. It's open to anybody that is interested. So you can take advantage of that. If there are any questions, Gina, in the chat box, I can answer those right now.
Yep, I'm going to go to the Q&A portion first, and then I also have some in the chat. So let's see, let's go to the answered ones. There were 2 that were answered. One question was, when do sports start? And the answer is sports will resume as normal at the start of the school year. And then another question referring to the middle school. Does it mean that there will be no lockers again because of COVID? And Leah answered, at this time, lockers will be used. We also have a question, what is weekly COVID screening for the students? Would you like to answer that, Kim?
Absolutely. We have offered online, on-site COVID testing at a central location using the Pioneer, the trailer in front of Pioneer School throughout the course of this school year. We have partnered with Shield, Illinois, which is a saliva-based RT-PCR test. And they will be providing this service to our district next year in each and every one of our buildings. So each of our buildings will be a testing site, as well as a location where screening can be done weekly. And both students and staff will have the opportunity to voluntarily participate.
Okay, so let's see, who will be screened weekly? Is that staff or students? So we just answered that. Will D33 require all staff to be vaccinated and/or tested regularly for COVID?
So we are not requiring vaccination, although most of our staff are now at this point in time. They're, as of the end of the year, we had 80%. We anticipate that number is much higher since the summer, but we are not requiring that at this point, and we're not requiring at this point shield testing, although we are highly encouraging it and working with the teacher union to discuss that, to encourage our staff to participate. Again, with students, those that are optional, that's a parent choice. We're not requiring that vaccination at this point of students. That is a parent choice, as well as the shield testing or screening. We want to encourage that because we really believe that screening will minimize the time that children are out of school. It minimizes that quarantine period. We'll provide a little more information to parents specifically on that so that you can understand the rationale, but it really will help us to, one, keep kids in school and minimize the disruptions of instruction.
Okay, will students have to carry around those plastic shields in the middle school again?
We are not doing the shields this year unless a parent requests it.
Okay. How would masking be enforced in a situation where masking for unvaccinated only is chosen?
So that's the clarification we received today from the CDC. That was some of the things, some of the concerns they had, as well as how do you monitor all of this in schools in large settings where we have the majority of the students are not vaccinated. So they have pivoted to the statement of universal masking in schools regardless of vaccination status. So all students and staff will be expected to wear masks until that changes, until things improve. There is data to show that things are not headed in the right direction right now. So that's, I think, another reason why they put that in place as far as the local metrics and national metrics. But right now we are following that guidance, and we'll be expecting students and staff to wear masks while in school, as well as visitors. That is indoors. We are understanding that outdoors masks are not required, so kids will be able to take mask breaks at this point and not have to wear masks regardless of vaccination status. And we're still receiving some guidance on sports. I believe the same holds with sports at this point in time, unless otherwise changed, that they are not requiring or recommending, or it's optional to wear a mask during sports at this time. And I'm telling you, all of this is new as of, I think, 4 p.m. And we haven't had a chance to see the other updates, and some of those haven't even come out yet. So at this point in time, it's really a universal masking indoors and not outdoors.
Okay. I'm not sure if you answered this already, Kim, but I'm going to put it out there. What does screening entail? Is this just asking questions, or is it some kind of test that is less invasive than the actual COVID testing? Great question.
That's a really great question. Actually, the Shield Illinois test is less invasive than the test that the district was using earlier this past year, which was a nasal swab and a deep kind of back of the throat swab. So it was rather uncomfortable. The COVID Shield test is a saliva-based test, so it's a spit test, for lack of a better word, but it's much easier to obtain a sample. So that is the method that we'll be using this year.
Okay.
And that's for both screening and testing. It's the same.
That's correct.
Same test, screener.
So this is, what if, okay, so we already answered this part. If a parent does not want their child screened or tested, they don't have to. Will they need to quarantine for a certain amount of time, though, if they're not tested or screened?
If a child is symptomatic, yes, there are still exclusionary guidelines that we do have to follow if a student is displaying symptoms of COVID or has been determined to be a close contact of someone who has tested positive for COVID. It's always a family choice whether or not they choose to get tested. But if they choose not to, then there is the standard protocol for the length of time that a student must quarantine.
Okay. What is the district doing regarding the hot weather with masks?
So we have had this discussion. We are obviously also concerned about that. I know that's a concern for parents. So we would look at a heat index of 85 degrees. We have minimized that for indoors. And we do have the capability of monitoring all of the individual classroom temperatures. So we've been working with the business department as well as our buildings and grounds to increase fans. We do have some fans in our classrooms, but increasing those fans in classrooms. Karen, do you want to talk a little bit more about some of that ventilation and things that we put into place? I don't know if Fred's on this call.
I don't believe he is. We are currently looking into and getting quotes for a variety of different fans and looking to see what might be the best option to add to those classrooms that are exceeding that heat limit.
We also do have additional cooling units in all of our buildings. I believe we have 2, which are large size air conditioning units to create cooling stations, either in the hallways, the gymnasiums, knowing that, we're hopefully going to have air conditioning universally in our buildings soon in the next few years. We're crossing our fingers, but in the meantime, knowing that this is important to parents, we're putting in some other additional ventilation and to cool off classrooms. But yes, we are cognizant of that and going to be monitoring that. And in that event, if it does get to be too hot or uncomfortable, if it's a few classrooms, we would move them. If it's an entire building, then we would probably have to go to remote learning.
Okay, so I know we've already said that screening is not required for staff and students who are vaccinated, but Kim, could you speak to the benefit of the screening for those who are vaccinated?
Absolutely. For those who are vaccinated, it has been published and shared that even with vaccine coverage, you can still get COVID and you can still spread the virus. That said, some individuals who get COVID don't actually develop symptoms. And the point of getting the vaccine is to reduce symptoms. So in those cases, it's possible that a vaccinated individual could be positive for COVID and not know it. And so we would still encourage even vaccinated individuals to participate in our weekly screening, since we do still have students under the age of 12 who are not eligible for vaccines at this time.
Thank you. Will breakfast be available in the morning at school for students rather than sending it home the night before?
Yes.
Karen, do you want to answer? Oh,
Go ahead, Karen. Go ahead.
Yes, we'll be serving breakfast at school and of course lunches at school as well.
will there be a chance for those that have not gone into the building to have an orientation day with COVID issues?
If you have concerns or want additional information, please, by all means, communicate with your child's principal. They are all aware that there are parents who have questions. They'd be happy to meet with you and discuss anything that you need reassurance on, as well as we are going to continue the principal coffee sessions for parents via Zoom. So parents, if they have weekly questions at the start of the year, we know that that's when a lot of parents have questions. We do intend on continue that, so you can ask directly through a Zoom call as well if you can't get to the building.
Can I add to that, Christina?
Absolutely.
We also have something new this year, and I believe Gina will be sending out information soon to parents, but we are going to have Meet the Teacher and Drop Off Supply Day on, I think it's August 24th. So look for an opportunity to come into the building then as well.
We also at middle school, do you want to speak to that, Leah? We have a transition night as well.
So there is a 6th grade camp that's coming up that the middle school has put information out and will be sending additional information on. And at the middle school, there is also a walk the schedule night that is typical to normal years at the middle school, just not during last year because of COVID and being remote. But that walk the schedule night will be for students to get their schedule and walk through the building. And if you're a 6th grader, learn the school, and if you're a 7th and 8th grader, reacclimate yourself to the school.
If a student tests positive for COVID, will they still be considered immune for 3 months following?
When a student tests positive for COVID, we do rely on guidance from the health department in terms of what that release from quarantine date is. Current guidance does show that for up to 3 months following a positive COVID diagnosis, an individual could continue to test positive. for COVID because of the antibodies that are still in their system. We are not health experts, so we really do rely on our nurses and especially on our health department for individual guidance on specific cases.
Okay, and just to reiterate, we did say that the plastic shields that the kids carried around will no longer be necessary unless a parent requests that. That's both at the elementary and the middle school level. Just want to reiterate that. Does a child with asthma is a child with asthma considered medically exempt from wearing a mask? Could they wear a shield instead?
My best answer for that is it depends. It depends on the severity of the asthma. It depends on the recommendation from your physician. An asthma diagnosis doesn't automatically exempt anyone from wearing a mask. So I would really encourage you to reach out to your physician and talk to him or her about whether your child can safely wear a mask. And if your physician feels that mask breaks are needed or that a mask is just not safe for your child, if you provide that medical documentation to your building principal, they will set up a time to meet with you and develop an accommodation plan where possibly a shield or some other type of protection could be agreed upon and a plan developed with you.
Okay, some questions about masks. Will there be guidelines regarding what types of masks are acceptable? For instance, personal masks or paper masks?
So none of that has changed. It's typically been the 2-ply double layered masks that we're all been wearing, either those paper masks, surgical masks, those that you can buy at the store. So it's similar to what we've been wearing in the past. So none of that's changed.
Okay. Can parents come in and volunteer in the preschool now?
So the purpose of following these layered mitigation strategies such as masks and hopefully getting a large participation in screening and adhering to some of those distancing of 3 feet, which is really pretty much what our desks are at in classrooms that are normal year. But the purpose of following those guidelines is so we can resume normal activities as we would, even though we recognize that there's personal opinions about masks and they're not, none of us want to be wearing masks anymore. However, we're putting all these things in place so that we can have visitors back in our buildings, so we can have evening events, so kids can participate in sports and clubs, so that we can have kids interacting in classrooms as they normally would and doing activities that they normally would. They can eat lunch at school. Those are the reasons why we are adhering to the guidelines so that we can resume a normal year as normal as possible, and have parents in our buildings volunteering. We'll ask our visitors to wear masks, but we feel if we follow the guidelines, we can resume as normal a year as possible, provided that we're following some of these guidelines.
When would the shield screening happen? Before or after school, during the day?
I'm sorry, could you repeat that, Gina?
Sure. When will the screening happen? Does that happen before school or after school or during the day?
It would happen likely during the day, but that has not been determined yet. That's something that will be decided with input from the principals as well as those who are providing the service.
Okay. Will there be a definitive list of symptoms that require a test or quarantine? Last year, they did not require test or quarantine for runny noses in preschool, which was so nice.
Yes. We follow the guidance from IDPH. They have a standard list, and that is what we're required to follow in schools.
And that has not changed that we're aware of. That's the same as what towards the end of the year, I think, when they made that change. So.
Okay. Is there any indication when a vaccine for under 12 will be available?
So we have been consulting with the Pediatric Health Associates, the president, Dr. Shashara, who was supposed to be on this call today, but had a last minute emergency at work. However, he has told us that originally was planned for August, September, and now they're saying the winter, that they anticipate having a vaccine for students under 12 or children under 12.
What are the statistics on accuracy for the saliva screening / testing? Great question.
That is a great question. I may have to get back to you on that. I do have some information and research that I'd be happy to share. Gina, if you could share that individual's information with me, I could pass that along.
Absolutely.
It's in the very high 90%. I want to say 98%,
Yeah.
but don't quote me on that.
I also just want to point out that the shield testing will be a completely separate presentation for parents when we roll that out, as they decide if they want to opt in or opt out. Same for staff. So we will be putting together a separate, more informational meeting on that as well.
Okay, so Alicia if you could please put your contact information in the chat, and you can just send it to me, Gina Steinbrecher. It'll be it'll be hidden then, and I can make sure that I share that with Kim so she can get back to you on that.
Thank you.
Masking is recommended, but is not required by the CDC. I know there are some people against masking and will refuse to send their kids to school in a mask. What will you do in those cases?
So as we said, we do understand that there is some interpretation of recommendation. Not being local medical experts, we are going with the guidance, which has been pretty strongly worded by the Illinois Department of Public Health. So far, at least as of today, they came right out after that with strongly urging schools. And also to, I'll just be honest, our insurance carriers have stated that we need to follow the guidance as well, because that they provide our coverage. So I think there's some real strong reasons why, safety wise, not being medical experts, that we need to follow that guidance. We understand that there are people who may not want to send their child to school in a mask, just as we have any other health related requirements in schools. We will have to exclude a family if they're not willing to follow the guidance and follow the masking requirements that are being put out by the CDC. That's a prevention strategy to keep kids in school. And so we will have to work individually with families. We want to do that first and just talk through what are some of their concerns. But ultimately, if that is a choice by families, we will have to look at what are the alternatives. That might be something that they personally have to make a choice on. But we really just want to work with families first to find out what is the concern, work with them individually to create a plan. In some cases, a lot of times it's just the child can't tolerate it. And we've had to work individually with families to help the child tolerate the mask. And that's completely understandable as a parent, that you wouldn't want to send your child to school if they can't tolerate it. So we've worked through that with families this past year successfully. We didn't have any issues. Summer school went really well. As you saw our numbers, every child was wearing a mask. We had a large summer program. They were indoors and out. We had no issues with having to shut school down, exclude kids. That was very minimum. And the children did really well. So we really just want to work with families and understand their perspective and understand that we understand there is a personal preference on this, but really at the end of the day, we are responsible for 4,000 students, and our goal, our priority is to keep kids in school, keep kids safe, staff safe, and minimize disruption for families.
Okay, the next question is, since the info is so new and our governor stated he will be reviewing the information and hasn't made any decisions yet, isn't some of the information about masks more the cautious route?
Mm-hmm. Right now, we are taking the cautious route. We took the cautious route throughout the last year. We were one of the higher levels of transmissions in the DuPage County. I anticipate, and as I said, we're still waiting for additional information from the DuPage County Health Department, as well as Illinois State Board of Education, and the governor did put out his proclamation about some of this guidance. All of those entities have pointed to following the CDC to keep the priority of students, to keep that priority at the forefront of keeping kids in school, because that is the bigger I think health concern at this point is kids being out of school. So we understand there could be some additional changes, and we will change with those. If those measures loosen, and guidance loosened, then we will, and we're following the guidance, we will also, but we are adhering to the guidance. We feel it's clearer for parents, it's clearer for our staff, and it provides us information that we, not as medical professionals, can work from.
Will they be wearing PE uniforms this year at middle school?
So as you know, I'm not the Lehman principal anymore, but I am communicating with Maggie Lay, who is the new Lehman principal. And yes, students will be wearing PE uniforms this year and will be changing for PE as normal.
You know, there are some here that are not necessarily related to COVID, but I would like to answer them regardless. Will the Park District be offering their before and after school programs as well? Do we have an answer for that, or do we need to get back to this person?
We'll have to get back, but my understanding is yes, but I don't have a definitive answer on that yet.
Okay. When can we expect to see school supplies lists updated for sure? They are on the website right now, and they are the final school supply lists. So you can find that on the website. Let's see. Just a nice comment. Thank you so much for all you do. I appreciate this conversation. Who would have thought we'd still be going through this another school year? Absolutely. Another question, if a child tested positive, would it just be the one classroom out or the whole school?
If and when a child tests positive, the first thing we do is follow our protocols from IDPH. And we start with contact tracing and identify any students or staff who may be a close contact. As we said earlier this evening, that definition of close contact has changed from those individuals within 6 feet of that person who tested positive to now anyone within 3 feet. So that bubble has gotten a little bit smaller, which is a good thing. That means fewer students out of school, less disruption. But after we have conducted the contact tracing, both in the classroom, on the bus, and the lunchroom, we identify who those students are who may be a close contact, and those individual families are contacted, and those students are required to quarantine. The remaining students would receive what we call a low risk letter from the building principal, notifying them that there was a positive case identified in their child's classroom or in their child's school, so that, you know, a family can choose to screen if they would like. But again, that would be that student would be at very low risk for contracting COVID, but we do notify families nonetheless. The only time we would shut down an entire classroom is if all students in that classroom were considered close contacts, or we had multiple positive cases within one classroom or school.
Okay, let's see. Do students wear masks in sports?
This is what we're still waiting on. What I understood to the previous guidance was that it was highly encouraged, and in addition to screening students, which you'll see on many sports teams, particularly close contact sports, we're doing the screening. Kim, do you have anything you want to add to that? Because I don't know what is most recent, if there's been any additional changes.
Yes, I do know that screening is highly encouraged for participation in sports, whether that's indoor or outdoor, just because of the exchange of bodily fluids with sweating and, you know, being outdoors, and you know, when you're doing cardio, you're breathing heavy, and, you know, the droplets obviously can travel further even if you are wearing a mask. So we really will be encouraging athletes who participate in sports to also participate in our screening program as well.
Okay, just to reiterate, students at the middle school will be able to use their lockers this year at this point. Let's see. Where do you get the uniforms from? I believe they're on the school supply list. Is that correct, Leah?
No, parents pay for that with registration fees. So that's included with middle school, and they will receive those PE uniforms during the first week of school. So they will not change for PE typically the first few days of school. And at that time, the physical education teachers will pass out the uniforms. They will receive a shirt and a pair of shorts.
Okay, and just as a reminder, the Board of Education did waive registration fees for this year. So just to answer that, in case anyone was wondering about that. Another comment, thank you so much for making time for this conversation. It's very helpful for us parents. Feel better that the district is looking at the safety of the students and the staff. If the student is a close contact, then they get tested. Can they come back to school if they test negative, or do they have to quarantine for 2 weeks anyway?
This is a great question. Unfortunately, if someone is exposed to a COVID positive individual, it does take several days for symptoms to develop. And as we've learned over the last year and a half, especially in young people, oftentimes students will not have symptoms or have very mild symptoms and be COVID positive and not know it. So the health department and the current IDPH guidance does state that a close contact can't test out of quarantine. They do have to quarantine for the 2 weeks anyway. However, by getting tested regularly during that quarantine period, you prevent that opportunity of spreading within your household while the child is quarantining.
Okay.
There is, though, Kim, a difference for screening, though. If you participate in weekly screening, can you clarify that? If you're not symptomatic, if you're just participating in screening?
Yes, if you do choose to participate in screening, I wasn't sure if yes, I'll get into this, I guess. We'll go there. If you're participating in the screening program weekly and are determined to be a close contact, you may not have to quarantine. So that is another advantage to participating in the screening process. The theory in that and what the research shows is that by screening weekly, you're able to identify COVID before you have symptoms.
Okay, are the most current District 33 guidelines as they change available online?
So we will be updating that. This is our first presentation and first distillation of all of the guidance that we've received over 3 weeks. So you're getting the most up to date, but we will be posting this presentation. We will be putting our return to school plans after the board meeting on August 5th. August 6th, we'll put out whatever we know at that time out to parents, given that there might be more changes, and then post it as long as there aren't changes. As there are changes last year, we were routinely taking things down and putting things back up. So we will continue to do the same.
Will the students eat lunch in the cafeteria instead of their classroom?
Yes, when possible, provided that the 3 feet of social distancing can be adhered to in the cafeteria, they will eat there. When that's not possible, students will continue to eat in their classroom. It really varies from building to building, but when at all possible, we really do want to see our students return to as much of a normal day as possible.
Can I add to that, Kim?
Yes, please.
So we know at the middle school, we will be able to maintain having middle schoolers eat in the cafeteria. We know that we have enough tables and that they're of an appropriate size that we can allow that to happen. In the elementary schools, table size and number of table varies from school to school, as well as our total student population at each grade level varies significantly. So the answer to that will actually change based, as Kim said, based on the building or even the grade level that we're trying to feed at that time.
Okay, just just a reminder, there is a question. Someone came in a little late and is just asking about, just saying, is the district not offering remote learning? So there will be no remote learning this year except for specific incidences, and that would have to go directly through student services. It's 5 days a week in-person learning. We do not have remote Mondays anymore. Christina, I don't know if you want to add to that?
The only way, pursuant to the Illinois State Board of Education recommendation or proclamation, which was back in end of May, we do have to provide remote learning to students that were ineligible or unable to be vaccinated, as well as under a local quarantine order by the health department. So, for example, if your child's in elementary school, they're obviously not eligible for the vaccine. If they're in close contact and the health department deems that they must quarantine and be home for 14 days, we are required to provide remote instruction. So we do have teachers assigned to that, to be a liaison between the teachers and the students and the parents, to ensure that the assignments that are provided to the students during that quarantine period are completed, that they get support and communication between the classroom teacher. We are not providing simultaneous instruction anymore, where you had the teacher doing both, two different groups, one at home and one at school. That it's no longer. As we all know, we heard a lot of feedback from parents that did not work well, and it's not something that's even allowed under the new ISB guidance. So it's strictly back to school unless your child is under a quarantine order and is not vaccinated.
Okay, so that's all the questions I have about COVID. So there's some about middle school that I thought we could answer. And I'm going to put this out to Leah. Do we have to buy locks for lockers for middle school? And will students still be able to use their backpacks at middle school throughout the day?
Yes, just to clarify, the PE uniforms and the locks for lockers are separate fees that are not part of the registration fee. Those fees are not waived. So I believe that the locker locks are, I think they went up a little bit, but I think they're, I want to say around $13 for 2 locks. That is for the lock for the locker, and that is the lock for the PE locker as well. Both locks have the same combination. So students do not have to memorize 2 combinations. They're sold as a set of 2. So we do ask that students use the school locks that are provided. In case of emergency, if a student needs to go home and we need to get items out of their locker, it's really helpful to be able to have those combinations and the master key that's able to open those locks. So we are asking that all students purchase the school locks for their lockers, and that's pretty standard every school year. Also, backpacks will no longer be utilized during the school day now that we are moving back to lockers.
Okay, so I believe, how do we pay for gym uniforms? You do not have to pay this year.
Gina, I think that they are separate fees this year. We just need to clarify. They are locks and PE uniforms are at middle school are typically separate fees.
Gotcha, I'm sorry.
And sports, any other extra activities that require a fee, we do still have parents pay for those. Just the registration fee is waived district-wide. And we can again clarify that, but you can pay those fees online through the portal, or also go to the building and pay directly.
Okay, I think that is all we have here. So no more questions are coming in at this time.
So we really appreciate your time. A lot of these questions are helpful to us as well to know what parents are thinking. If you have additional questions that you put in that chat box or in the form that Gina posted, we will get to those as well. Somebody will reach out to you. And really just next steps are getting ready for school. And unless something changes, we will keep you informed. Expect the next communication on August 6th, unless you reach out to us personally. And as always, I am happy to field questions. Give me a call, email me, we can meet. I've done that many times with parents. So if you have concerns or questions, please reach out personally as well if you don't want to wait till August 6th. Otherwise, you can expect more information on the start of the year and all these plans and any possible changes coming on August 6th. So thank you again.
Oh, there is one last question. How do we, this is for Karen, how do we find out the bus schedule and timing?
Yep, the bus schedules will be uploaded to the Home Access Center when they're complete, and we will send out a message to all parents to look that they're available on the day that they become available.
All right, thank you again. We look forward to seeing your kids back in person this fall. We're very excited. We've been planning all summer for this, so we're just looking forward to it. We hope you are too. Have a great rest of your summer.